We're here at the ASCO 2023 meeting discussing the ZUMA-7 clinical trial. ZUMA-7 was a global phase 3 randomized clinical trial evaluating axicabtagene ciloleucel, or axicel, a CD19 targeting CAR T-cell therapy against the previous standard of care, which was chemotherapy followed in responding patients by high-dose therapy and autologous transplant. We've previously presented the primary endpoint, which was event-free survival, statistically significantly favoring axicel, which we published last year in the New England Journal of Medicine. This year, we're presenting the primary analysis for overall survival. And what we found is that axicel improved significantly overall survival with a hazard ratio of 0.726. Very impressive results. This is the first time in nearly 30 years there's been a statistically significant improvement in overall survival in second-line large B-cell lymphoma. The clinical significance of these findings is highlighted in that over half of the patients on the standard of care treatment on ZUMA-7 went on to receive subsequent cellular immunotherapy, basically receive CAR T-cell therapy after not responding to second-line chemo on trial. That is effectively the previous paradigm of try chemo first and either go to transplant or save CAR T-cell for later. The findings from our study definitively conclude that the old paradigm is inferior to using axicel as a second-line treatment. And so we believe that our findings represent a paradigm shift and that axicel should be considered as a second-line treatment option. We expect the reaction to these significant improvements in overall survival to be a potential shift in the paradigm for how we treat second-line large B-cell lymphoma. Overall, the entire primary overall survival analysis found a 27.4% reduction in the risk of death when using axicel as a second-line treatment. That's hard to ignore, and so we think that axicel as a second-line treatment deserves to be considered as perhaps the standard of care, if not a standard of care, for this patient population going forward. Yeah, the ZUMA-7 clinical trial was a paradigm-changing trial, but obviously we have more work to do. The overall survival rates at 4 years were 54.6% in the axicel arm, which is better than what we'd seen previously, but still means that about half of our patients, we still need to do better. And one approach to do better is to perhaps use our best weapons at an earlier time point in the cancer timeline. And we're specifically looking at this in the ZUMA-23 clinical trial, which we have a trial in progress here at the ASCO 2023 meeting, which is a randomized global phase 3 study evaluating axicel as a first-line treatment option compared to the current standard of R chemotherapy. This is the first trial in any cancer to look as a CAR T-cell therapy for patients with newly diagnosed cancer, and we're eagerly anticipating the results.